Hi everybody, this is Dr. John Hayes, once again back for another Sunday night edition of Beating Neuropathy on Chronic Pain. Of course you're listening to 95.9 WATD. And what I'd like to do today is to just kind of recap where we're at so far in the show. I want to talk about what we've been able to accomplish so far, and in doing so I'll be able to answer some of the questions that we've had. And then we're going to move on, and what I'd like to do tonight is I really want to spend a considerable amount of time talking about chronic pain. Chronic pain is something that affects almost every family, probably in the world, but certainly in the United States and most modern countries for sure. But anyhow, what we've been able to accomplish so far in the last 8 weeks of Beating Neuropathy is to really set the stage for what neuropathy is, what chronic pain is, and so on and so forth. And what we've done with our guests in the last 4 shows are to talk extensively about lifestyle, particularly diet and health habits, if you will, and exercise and fitness and so on and so forth, and all the roles that they have in not only the treatment of chronic pain, but I think probably more importantly is the actual prevention of chronic pain, because the bottom line is that for most of us, barring any underlying genetic or serious medical condition, that keeping ourselves fit, keeping ourselves relatively trim throughout life really goes a long way towards warding off a lot of the what we may even call the social ills. We spent a lot of time this past month, excuse me, talking about metabolic syndrome, and the reason we did that, quite frankly, is that metabolic syndrome is something that's actually rampant in this country, and it does set the stage for chronic pain, and it does set the stage for inflammation. Both of which are definitely detrimental to your health and well-being for a number of different reasons. But again, the whole rationale and the reason behind my previous guests, Russ McCann and also Laura Amaral, in the last couple of shows really was to let you understand and help you understand that by managing your body weight in particular, by keeping yourself fit and trim, you are not only warding off a lot of diseases and illnesses, but then you are also providing yourself really effective treatment as the cornerstone for much of what we're going to talk about in the coming weeks and months. But with that said, what I'd like to do next is to branch off a little bit and spend a little bit more time today talking about facing chronic pain, what it is, and try to dispel some of the most common myths. And I think in doing so, it'll be very, very beneficial for all of us. Chronic pain really is defined as pain that's either permanent or lasts for an extended period of time. Traditionally in the office when we talk about chronic pain, we've talked about historically pain that affects a patient for more than 3 months consistently. And there are different, of course, there are different grades of pain. Pain has been defined as an unpleasant emotional experience because there is a vast degree of difference in the interpretation of what's called noxious input or painful signals from the body from one person to the next. And this is one of the things that can be extraordinarily difficult as a clinician. There are patients, for example, that are extraordinarily hypersensitive to very, very little stimuli. For example, we all know people that stub their toe and you think they're dying because that's just what their brain and nervous system responds, or how it responds to that type of external stimulus. And we also know that, especially under periods of great stress, people can have some really devastating injuries, in fact, on occasion life-threatening injuries, and not immediately perceive any pain at all. So it's a very, very complex phenomenon, but the biggest issue with chronic pain becomes with the life disruption that it does cause. And this, again, is the key point, and of course one of the biggest reasons that we're here tonight. The chronic pain, again, is something that's defined as a pain that's either permanent or has lasted for an extended period of time. Unfortunately, it currently afflicts over 100 million Americans. The costs in our society alone are estimated between 600 and 800 billion. You know, that is a huge, huge number of people that are afflicted. One of the biggest things that, of course, we see with anybody who suffers from chronic pain is the adjustments that these patients are forced to make in their mobility, their comfort level, and their overall way of life. So it's a considerable source of disability, it's a considerable source of family disruption, life disruption, and so on. One of the other challenges that we all have now with regard to the availability of information is something that's been termed cyberchondria. And basically what cyberchondria is the type of behavior that all of us tend to engage in this day and age when we have a health issue, which basically means that the first place that we go now is usually Google. Most people go to the internet right off the bat, and you know, you can plug in any keyword like neuropathy or chronic pain, for example, and if you're home now, I would encourage you to search for those. And if you spend some time searching for those terms, you're going to find a whole slew and a whole variety of different bits of information. Of course, you'll see our information there, you'll see our videos and so on and so forth, but you'll also see sales pitches for potions and lotions and all different types of things that you know, once upon a time might have been called snake oil. You know, some of course are very effective and some are probably not. But the biggest challenge becomes when we let that type of behavior take over and really get in the way of making intelligent decisions. Which brings me to my next point, and the last point for this, you know, the first portion of today's show, and that is that one of the smartest things you can do is to recognize early on when pain is becoming a problem, because we all know very, very well in the clinic that the most common reason for chronic pain is not taking care of acute pain. So the moral of the story is that when you do have symptoms, when you do have an injury, if it's obviously serious, you should seek immediate professional medical attention. Obviously, don't be afraid to call 911 in case of you know, things like chest pain, acute abdominal pain, and so on and so forth. But the bottom line is that the better you can treat the acute phase of illness, the less chance you have of suffering chronic pain. So when we come back from our break, we're going to move on and talk a little bit more about chronic pain and everything else it accompanies. You're listening to 95.9 WATD.